Here we go, guys. Rapid fire Q&A. Let's go. Can I chew sugar-free gum? Ideally, no. Sugar-free chewing gum is full of additives, sweeteners, and goodness knows what else. Even though you are not swallowing the gum, you are certainly ingesting all this artificial rubbish that is going to upset gut bacteria and cause long-term issues that ultimately make weight loss more difficult. If chewing gum relates to your breath and ketones on your breath, then my advice here is to drink more water and brush your teeth more often. Next question sort of follows on from that one a little bit. Can I drink a diet soft drink? I know it can be really difficult to break this habit if this is something you have done prior to coming into the challenge, but the best time to stop drinking soft drink of any type is right now, and this is for many reasons. Firstly, they certainly don't fit into the category of being real food. Most of the chemicals, flavors, and sweeteners in these drinks we know very little about. Aspartame is a particularly interesting and controversial one. If you do a search in the Facebook group for aspartame, you'll see in one of the comments I put a link to a video about this sweetener. The video runs for about 7 minutes and it's really interesting. If you are a diet soft drink drinker, I highly recommend checking this video out. Artificial sweeteners have a number of negative side effects that we are aware of, and then many more that I'm sure we'll hear about in the coming years. There is some indication that despite zero carbohydrates, we still see an insulin response with certain artificial sweeteners, and hence our ability to therefore fat adapt is affected. The sweetness they create will also continue to perpetuate our need for sweetness, making giving up or reducing your sugar intake really difficult. What do you drink? Water is, of course, your best bet. Add a slice of lemon, get creative, put some mint leaves in, find some different herbal teas. Many of these you can drink cold as well, but stay away from soft drink. Next one, is it okay to exercise on fast days? The short answer here is yes. Yes, you absolutely can. When beginning low carb and whilst you are still adapting, exercise may be a bit of a struggle. Remember, your body is just not used to using fat as a fuel and isn't doing so efficiently and effectively as yet. As time goes by, you will get better and better at this. And so exercising in general will feel better and better. Fat adaptation and exercise or athletics performance is really a topic on its own. But is it safe to exercise when fasting? Is it okay to do this? Should you do this? Yes, yes, and yes again. You might not feel great initially, and you may need to tone down your sessions, but in time, through a bit of trial and error and becoming better at using your fat efficiently and also using ketones, all of this will improve. Can I have soy products like soy milk, tofu, tempeh, etc.? And are these a good source of protein? So the question of soy is a really common one for people who are wanting to follow a low carb diet, particularly if they are vegetarian. Or you might simply have a preference to just have less meat. We can categorize soy into 3 main categories. Category number 1 would be whole soy, like your edamame beans. The next category would be fermented soy, like miso, tamari, tempeh. And the third category would be processed soy milk, cheese, flours, tofu. So as I always say, your default should be JERF, just eat real food. You can check out some videos online about soy processing. This involves a large amount of chemical processing, acid washing, neutralization solutions, and high temperature treatments. It is not a comforting picture at all. And for this reason, I would be recommending that anything in group 3, the processed category, is off your list. So that is a no to soy lattes. Definitely not a good option. Fermentation, on the other hand, has many benefits, particularly those related to gut health, which we are learning more and more about. And therefore, if you are going to include soy in your diet, then either it comes in the whole form or in a fermented form. Those would be your best 2 picks. Now, organic is something that is vital when it comes to soy. Nearly all soy is genetically modified, and it has one of the highest pesticide contamination levels of any crop. Other considerations with soy: there are plant hormones present in soy that mimic estrogen. This is a potential problem, with some studies indicating that this could potentially mess with the estrogen receptors in our body. The evidence here is, however, mixed, and there is a lot of work to be done. However, I would be very cautious when it comes to soy. Soy is also high in something called phytic acid, which blocks the body's absorption of some minerals. The fermentation process does reduce phytic acid, but not completely. A big problem with soy is that it is used as a bulk filler in many processed food items. So it has been present in our diets in amounts a lot higher than we realize. I could go on and on, but basically, if you're going to have soy, choose whole or fermented forms only and have it on occasions only. So the next question sort of follows on from that a little bit and says, if I'm ordering a milky coffee at a cafe, what milk is best? Almond, skinny, full fat, soy, the list goes on. Well, full fat cow's milk is your best option here. Stay away from soy, as I just said. Anything skinny, low fat, light diet, these sort of things should never enter your diet ever again. Hopefully you are convinced of that by now. Full fat is the closest form to real food and has the least amount of carbs. When it comes to almond milk, it depends on why you are having this. If you can't tolerate dairy, then this can be a reasonable option. However, many almond milks have sugar and other funny things added to them. So be sure to ask the cafe if you can check the ingredients, which almond milk are they using, know exactly what you are putting into your body. If, however, you're having it because you think it's just a healthier option or a better option as compared to cow's milk, well, think again. There is actually very little nutrient value in almond milk. It's pretty void of anything good for us. Consider that in a litre of almond milk, we only have about a handful of almonds. So very little nutrient quality and quantity. Yes, that does mean that it has very small amounts of carbohydrates, but is this adding any value to our diet? And while this is okay to have on occasions, I wouldn't say that almond milk is a valuable component of anyone's diet. And the next question again relates here. Can I have a latte between meals? No, no, no. If you want a coffee between meals, it should be a black coffee. The milk in a latte is going to give you a good whack of carbs. Anything from 12 to about 20 grams of carbs, depending on the size of the latte or cappuccino, whatever it is that you have, and is therefore going to give you a nice big insulin spike. A latte isn't a good idea between meals, and it isn't actually a good idea with a meal either. Again, it is just too many carbs all at once. If you want a milky coffee with your meal, then you need to go for something with less milk. You could ask for a half full latte, or even better, something like a piccolo or a macchiato. Since starting low carb, high fat, I'm suffering from reflux, or my reflux is worse. What can I do? In most cases, reflux will improve or completely resolve when following a low carb diet, although this may take some time to occur. It is a common misconception, and one perpetuated by the very drug companies that market the drugs for this, that reflux is a result of too much acid in your stomach that is then pushed into the esophagus. Whereas what we really know is that as we age, we get decreased levels of stomach acid, and we also see increased rates of reflux. So something is amiss. Most medications prescribed for reflux do the exact opposite of what you want them to do, and although they relieve symptoms, they are not looking after the cause of the reflux, which is low stomach acid and or a dysfunction with the valve between the stomach and the esophagus. What I'm trying to say, without getting too complicated, is that acid reflux medication should be avoided, and we should rather be looking at the cause. In most cases, reflux is caused by either overconsumption of carbohydrates or overgrowth of bacteria in the stomach. Going low carb, therefore, mostly resolves reflux in time. However, for some people, symptoms are ongoing or may even worsen when going low carb, and this may be because proper secretion of stomach acid needs to be restored. So things that you can do to aid in this include, number one, a probiotic. And when I say this, think jerf, not pill popping once again. So foods that provide good levels of probiotics include things like fermented foods, kefir, sauerkraut, kimchi, but you would only want these in very small amounts. The second thing would be to avoid all artificial sweeteners. The third thing is apple cider vinegar or lemon juice. These two things have been shown to be helpful. You could use these as part of a dressing or in hot water. The fourth thing would be to avoid drinking water with your meals, as this can further dilute your stomach acid and make things worse. So always drink away from food. The fifth thing is homemade bone broth, and this is great for healing the stomach lining. Failing any improvements with all of this, I would suggest seeing an open-minded doctor who is open to treatments such as hydrochloric acid and pepsin, and not antacids. So that's it for our rapid fire Q&A part 1. Look out for more of these types of sessions over the coming weeks.